Welcome to the Visionary Hotspot Extended, where real
Every
conversations
action you
matter.
take
I
becomes
run the Global Center for Medical Innovation here in Atlanta, Georgia. We're a nonprofit organization working with medical device innovators, entrepreneurs, startup companies to develop, build, test, and commercialize new kind of innovative, life-changing, life-saving technologies. And so the fundamental underlying thread of everything we do, it's all about the patient. We're passionate about improving the lives of others, not just here in the Southeast, but across the United States and globally. So the innovation sector is critical to this, and our federal and global policies really tie into that. Complicated, and I think the latest dialogue in Washington around immigration reform is really highlighted that in our sector in particular, in healthcare and life sciences, diversity matters, and it's really twofold. One, there's the national debate around bringing manufacturing back to the country, having jobs grow for Americans, which is great, and I think that's incredibly important. But we need to make sure that in order to support the growth of innovative technologies in the future, we have to make sure that the U.S. workforce is properly trained in advanced manufacturing, science, engineering, and healthcare in our sector to be able to handle that. In the meantime, there's a wealth of knowledge and lessons learned and talent across, and I think that the most innovative products that are going to impact society, you put diverse teams together and you get the best results of that for a large group of people. And so I think we need to be really mindful and cautious about the immigration discussion to make sure that we don't limit our opportunities on the world stage in competitiveness by not allowing those bright minds to come in and work with our bright minds. It's funny to hear you say that because I'm the daughter of immigrants, and I grew up in South Mississippi. My mother's English. She was born in Liverpool, England, and my grandparents and that whole side of my family was there, and they came to this country when she was 15. And so even in small town Mississippi, there was a broad understanding of other cultures and a great big world out there. There was never any discussion around we had to be, I always identified with being half English and half American, right? And so I think over the last 10 or 15 years, I moved to Atlanta from Washington, D.C., where all that diversity exists in Washington as well. And I've noticed a little bit less of that being in Atlanta. But the political environment, I think over the last 10 and 15 years, and, a combination of terrorism, starting with 9/11, general fear, changes in the economy as we shift from a manufacturing economy to a knowledge-based economy, all of those drivers and the negative impact in certain sectors of the country, with the political dialogue taking advantage of that almost to serve their own goals, I think has just created a culture of chaos, and at least a dialogue of chaos across the country. That the conversation really, the dialogue really needs to be happening in our communities at the community level across the country. I really fundamentally don't believe that all Americans or the majority of Americans thinks that we are becoming a watered down society. I think the notion of that to those who have it is frankly ridiculous. But I think that change is hard and scary, and we've been a society, a culture in America of working with our hands. You mentioned manufacturing and farming, and that's shifting to working with your mind, right? And understanding things that you can't necessarily visualize or touch when you're talking about artificial intelligence, big data, everything that's happening with the internet. It's just a fundamental shift in a skill set that makes people generally uncomfortable. And I think just being human beings, change is difficult and scary. And so we've got to be, but I think it has to happen on a local level where we're helping our people in our own community adjust to the industry sectors where innovation is happening in that community. I think if it continues to happen only in Washington, only on Capitol Hill, I think we're set up for just more divisiveness and failure. One of the things that we've seen over the last 15 years is a decline in the number of vocational schools across the country to teach those skill sets. So particularly, in medical devices, we've seen in advanced manufacturing, jobs went overseas for so long, and now they're coming back because the quality and level of scientific expertise that the U.S. provides is fantastic, right? And we want to have that quality here. But to your point, not everyone is going to work in the knowledge-based field and thrive and encourage the parents of our children today that those are fantastic jobs, right? So not everyone's going to go out and get a so-called white-collar job or be a coder, but that there are other skill sets around machining, farming, and kind of hands-on traditional jobs, and making sure that our young people today are well positioned to pursue those types of studies if that it is a good match with their skill set. And I do see, so I work very closely with universities, and so I've seen it where I've been fascinated I see a lot of women engineers, scientists inventing new technologies. I'm not seeing them starting companies or be involved in the entrepreneurial process that their male colleagues are. And I think fundamentally in the culture of academia, in a lot of these scientific disciplines, not being critical, it just kind of is what it is very male dominated. And there's a lack of mentoring, mentors for the younger women coming up in PhD and postdoc programs. And that's a never-ending cycle, right? So until we start to see some of that broken down, and we are seeing it now. I mean, I look at Georgia Tech, for example, and half the women in the undergrad, half of the students in that undergraduate BME program, biomedical engineering, are women. And so I have to believe that over time, when we can find the right mentoring and apprentice type structures to provide guidance, that we will see more women in senior roles in science, and then the cultures will follow that to allow for work-life balance, whatever that means, and those kind of broader opportunities. In healthcare, what we're starting to see, which I think is fantastic, is more input and more of the voice of the patient. So 10 or 15 years ago, the customer was the doctor for new medical technologies. And now, for a variety of reasons, with changing healthcare landscape, with new regulatory frameworks, with new thinking around how we bring life-changing technologies to market faster and still managing the risk appropriately, having patients' input on that is critical. We're starting to see more storytelling from those patients who were actually impacted at conferences, in trade journals, from medical device companies and pharmaceutical companies, getting those patient stories out. So you really fundamentally understand what the impact is on those. We're seeing with the regulatory world is that FDA and industry are really wanting to understand the patient's input into device design. Affordability is a big issue. It's obviously the fundamental challenge of healthcare reform and that current dialogue today. In the medical device field, you've seen a shift with the Affordable Care Act to value-based technologies. And so no longer is it really feasible to develop a Me Too technology, change a little bit of the design, and mark the price up. The dialogue for adoption is really coming from the purchasing department at the hospitals, from CMS in Washington, and the payers to show the cost-benefit analysis for getting something, for taking advantage of a new technology. So is it going to lower operating room times? Is it going to get the patient out of the hospital faster? Is it going to prevent the hospital from being, the patient from being readmitted to the hospital? And so those elements are critical in medical device innovation today. Whereas if something is going to cost significantly more and not provide a meaningful clinical benefit, those technologies just aren't going to be successful. So the industry, the healthcare environment is demanding from innovation to increase efficiency in the system, both from a healthcare standpoint and a hospital operations standpoint. It comes down to another dialogue in Washington around regulation, right? And so, I think we fundamentally need to revisit the role of regulation, the role of government in a lot of these advanced industries, because they are really interconnected. And we just need to be cautious when we're taking down, we're modifying healthcare regulations, but then also making it easier for some things to get on the market, easier to pollute our air, water, and soil, and not investing in preventive healthcare. It's just a perfect storm. We've got to, innovation is happening in all these different sectors. In clean energy, environmental purity, and protecting our environment. So I think we just really need to look at what policies need to be in place to be able to support and give those industry sectors a chance to grow, whether it's through, clearly defining the regulations, investing government dollars earlier in basic science and research, to lay the groundwork and the foundation for these industries, and making sure that the investment environment is able to nurture them along. But yeah, we work with their amazing minds trying to solve big problems across this country. Some of the things that I'm excited about is kind of the evolution of 3D printing. And, we've heard a lot about it over the last 5 years. The technology is evolving exponentially, and, we're starting to have dialogues now about how we manufacture that, how we maintain quality and consistency, how is FDA going to regulate it, who's going to pay for it, where does that happen? But there are technologists, printing body parts, soft tissue parts for kids with missing parts. There's been work for a while in terms of printing organs, 3D printing organs, and creating and seeding them with cells and reimplanting them into the body. So there's a lot of that innovation happening right now. It's really the challenge of jumping from innovation into a commercialization mode that's widely adoptable. And so that's the hard part, right? It's figuring out all of that. And that's where the government policies really come in to help facilitate that process and make it easier. So I'd say 3D printing, there's a lot of nanotechnology research, a lot of stem cell-based therapies for personalized medicine, cancer treatment, Parkinson's treatment, Alzheimer's, and again, the challenge is how do you jump from the bench in the academic center to the patient's bedside in an efficient way. And so that's where the innovation piece happens and the policy piece to enable that. Reached at twilson@devices.net.
Join us at thevisionarywoman.com, a media network of women, for women, by women. Watch our host of insightful visionary extended interviews. Listen to the Visionary Hotspot Talk Radio to empower your evenings and read fascinating articles, perseverance, and inspiration, all in mind. Visit thevisionarywoman.com and follow us on our social media pages, Facebook, Instagram, and Twitter.